smoking prouder. No, it won't more me. You are shale, we. I look you me. You chalela, you are no letty. For me, you are shale, we.
Across Ghana, the issue of mental illness is a social taboo. A fraction of those that suffer from it are kept and locked up at mental homes. The thousands more that are not at the mental infirmaries but are ostracized by their families find themselves on the streets. They sleep and find relative comfort in the open places, bus stops and subways. They are simply abandoned. The medical director of the Pantan Hospital, Dr. Dazi, shares this view.
Biggest problem we are all facing when it comes to psychiatric problems is stigma attached to it. And what follows is just outcome of that attitude towards mentally ill patients. And it, as I say, cuts across society. It doesn't matter if the people are educated or less educated, the fear and the stigma is always there.
Under normal circumstances, these mentally challenged persons on the streets are supposed to be arrested and put in mental homes and placed on medication. However, these mental patients who are supposed to be recovering at mental homes are left to determine their fate on the streets. Investigations conducted by our reporter reveal that a number of these deranged persons are placed on one particular medication at the psychiatric homes for far too long. Best practices, however, demand that pills given to these patients should vary. So one end result is for some patients to sneak out of the mental homes to avoid treatment, while another is for those at the homes to devise strategies to escape routine medication. This female patient receiving treatment at the Accra Psychiatric Hospital either throws up when she is given medication or plays pranks with nurses before she takes her drugs.
There is no law in Ghana that prevents any other entity from managing mental care, provided you have the requisite human resource, you have registered your premises as a mental health care facility, which is done by other organizations. You are also able to acquire your own medicines for treating or treatment in your private confinement.
These drugs constitutionally are free to be supplied to mental patients at the mental homes. However, some of these drugs equally find themselves at some pharmacies in the country. The chief pharmacist at the Ministry of Health, Martha Gansa-Lutrot, explains.
But those that the Ministry of Health procures are found in pharmacies, then that is a leakage. But I must say that some of the medicines that are selected for mental health could also be used for other conditions. A typical example is somebody with who has convulsions. Although we have selected a particular medicine for the mental health service, in the facility, people will run in there with needs for this. And so that is why you can find some of the mental health products in pharmacies.
In Ghana, the outpatient attendance at the 3 psychiatric institutions, Accra, Ankafo and Pantan, is about 800,000 per annum, while inpatients are about 2,000. The top 4 causes of mental illness driving a sizable chunk of the country's workforce to mental homes are cannabis, alcohol abuses, schizophrenia or mental deterioration, and depression. However, inadequate attention is given to mental health. At the Pantan Hospital, for instance, uncompleted structures are rotting away, while many mad people roam the streets of Accra and the entire country.
What is happening is, we actually didn't have the shortage last year of the, we call them old generation medications. we were having problems with the medication, the new generation medications, which are much more expensive also, and the prolonged time of procurement could have brought few glitches here and there.
Parliament has passed the mental health bill into law, and the hope is that it will address some of the pertinent issues facing mental health delivery in the country. But will it truly put smiles on the faces of this mentally ill community?